So what is the difference between a spinal and an epidural? My name is Jamie, and I am co-founder of Childbirth Allies. Something that Jen and I have noticed in working with clients is people don't realize that there is a difference between a spinal and an epidural. So both spinals and epidurals are placed by anesthesiologists or nurse anesthetists. Both of them deliver anesthesia for pain relief during labor or during C-sections, but neither of them require a needle to stay in your back. Spinal anesthesia just provides much quicker pain relief, but it also doesn't last as long. Typically, the pain relief lasts about 1 to 2 hours, and it is most commonly used prior to a scheduled C-section. So the needle is placed directly into the cerebral spinal fluid space. There's a little sac that holds the cerebral spinal fluid, and the needle goes directly into that space, and then the medication is injected into that space, and then the needle is taken out immediately, and you will notice rapid pain relief. An epidural, however, is placed in the space outside of that cerebral spinal fluid sac. So the needle is placed in the space outside of the sac, and then a catheter is thread through that needle, and then the needle is taken out, but the catheter stays in that space. Then the doctor that's performing the epidural will deliver a bolus medication through that epidural catheter to provide quicker pain relief, but then that epidural catheter gets hooked up to an epidural pump. So it will continuously pump medication into the catheter and into your back to continue to provide pain relief. So you will continue to have pain relief until that epidural pump is turned off. A lot of clients ask if there is a risk of the catheter coming out or if there's a certain position you have to stay in once you get an epidural. And we always reassure them that the epidural catheter is taped up a ton on your back after it's placed. And that's because the anesthesiologist doesn't want the epidural catheter going anywhere. Typically, the epidural catheter will stay in until your nurse gets you up after you have your baby, which is typically about 2 to 3 hours after you have your baby. And there's usually no pain with the epidural coming out. The biggest annoyance is all of that tape coming off your back before the catheter is pulled out. Hope that helps.